Hello, my name is Kevin, and I'm going to talk to you about complaints and the complaint handling procedure that was implemented across NHS Lanarkshire and NHS Scotland in April 2017. So after this short session, we will have considered the complaint handling procedure. We will have considered the principles and the best practice that support it, and we'll also have looked at some of the practicalities that are in place across NHS Lanarkshire for processing and dealing with complaints. So in April 2017, a standard definition of complaint was introduced. So a complaint is an expression of dissatisfaction, and it's about NHS Lanarkshire's action or lack of action, or about the standard of service provided by or on behalf of NHS Lanarkshire. From this definition, you can see that it is quite broad. So a complaint can range from car parking to catering, through to a misdiagnosis or care and treatment or communication. So it's just important to be aware of the breadth of the definition. So in April 17, a three-step process was implemented. So the first stage is frontline or early resolution, which is stage one. For issues that are more serious or have been unresolved at stage one, they proceed to stage two, which is a complaint investigation. The third and final stage, which is independent from NHS Lanarkshire, is external review through the Scottish Public Services Ombudsman. So if we look at stage one, uh, it is for straightforward issues. So that would be issues around uh, communication. It could be in relation to catering. I think there should always be due consideration of dealing with complaints at stage one, and it's only the more serious issues that should go into directly into a stage two investigation. So under stage one, then you have 5 working days to respond. There is the opportunity to extend that up to a maximum of 10 working days. So you just need to advise the complainant that you're seeking to extend it to 10 working days. Under stage one, it's important just that anyone could deal with complaints, so staff at any level, or it shouldn't matter about grade, site, or location. Staff should feel empowered to be able to deal with complaints at stage one. If we feel that if you feel that you can't deal with it, then it should be it could be escalated within your department. So if for example a healthcare assistant took a complaint, they could escalate it maybe to the nurse in charge of that particular shift or to the senior charge nurse. So there is that 5 working days then uh, internally to deal with complaints at stage one. The key point of it is trying to effectively nip it in the bud and try and identify the redress that the complainant is seeking. So if the patient is saying, I'm looking for an apology, or I'm looking for a discussion with the senior charge nurse, or I'm looking for an explanation of why this test result wasn't communicated to me, it is about trying to work out what would make it better for the complainant. So within NHS Lanarkshire, the recording process for stage ones remains paper based. So all sites should have paper forms, or they're available in Versport, which you fill in and return to your patient affairs department. The patient affairs department then records them in Datex. That's important just for a number of reasons. There may be issues that you've dealt with and perhaps haven't recorded. It's just important then, if it escalates to a stage two, we will be looking for a trail of who dealt with it at stage one, and what was the actions or what was the learning from stage one. So then it's just letting us join the dots then between a stage one process and a stage two. The other important reason for it to be recorded is ensuring that themes and learning could be identified. So if the same issue is recurring in your ward or in your location, it obviously is an indicator that something is wrong. So it's just trying to capture that information. So if something is unresolved at stage 1, or if something is so serious that it merits going straight into a stage 2 investigation, we deal with that within 20 working days. So the response should be issued to the complainant within 20 working days. In the main, it should achieve the 20 days. There will be certain investigations, perhaps maybe a core witness or someone who's been involved in that patient's care is off. So there is scope to extend the timescale, but that needs to be done via patient affairs, and it needs to be in agreement with the complainant. I think it's about getting a balance of timeliness against a robust and thorough investigation. So if a complaint is so serious and it involves multiple individuals and multiple departments, uh, there may be scope to extend the timescales. I suppose the message is it should be the exception as opposed to the norm. So nationally we report against that achievement of the 20-day working target. So a stage 2 response then, it represents the final organisational position. So at that point, the only other redress that the complainant has is through the third stage, which is through the external review by the Scottish Public Services Ombudsman. So it is the full and final response of the issues raised by the complainant. Also, stage 2 then, it provides us another opportunity to identify and communicate the learning to the complainant. So we are making some changes in our processes. So if you're asked for a witness statement under stage 2, you will be asked to reflect on, was there an opportunity for learning, or what would be done differently? And the principle behind that is that if you've been directly involved, you are likely to be the person best placed to identify that learning, or to give it consideration. We're also changing the stage 2 responses. So the complaint response will conclude with a summary of what learning has been identified from the issues raised by the patient or the complainant. So the third and final stage then is independent external review, which, as we've said, is the complainant can take their complaint through the Scottish Public Services Ombudsman. So the Ombudsman then would likely refer it to an independent clinical advisor, and then they would respond back and would make a judgment whether it was reasonable. The approach that NHS Lanarkshire took was reasonable, and they too can identify learning and improvement actions. So the complaint handling procedure was standardised across NHS Scotland in April 17. So that was to take a consistently person-centred approach. So it's putting the complainant at the heart of it. It's also recognising that the complaint handling procedure is based on complainant perception. So if Mr. Smith believes this happened, that is his truth. So part of the complaints procedure then is looking at that specific issue. I think it's also, if Mr. Smith complains about point A, we respond specifically about point A. We don't give a chronology of his care, so we don't go from A to Z. We just respond to the specific issue raised. So we're implementing a process called heads of complaint. So at stage 2, so we would ask the complainant or interpret the information that they've provided and say, from our understanding, you have complained about issue A, B, and C. They're then asked to identify if there are other issues included. So that's just about recognising and defining the scope of the investigation. So in the past, we used to keep it quite open, I suppose. So, if we received in a complaint letter, we could have give it to, consultant A, Dr. B, and Dr. C, and they could have interpreted the letter differently. So now what we're doing is patient affairs are actually agreeing the scope of the investigation with the complainant. So then we are responding to the specific issues that they've raised. The other purpose of the complaint handling procedure was a standard process. So as we've said, um, it is based on best practice. It was developed in conjunction with the Complaint Standards Authority within the Scottish Public Services Ombudsman, who are responsible for the majority of public sector complaint handling across Scotland. So the third aim of the introduction then was for staff and people or complainants is to give them confidence in complaint handling. So this is really just saying that there is that three-stage process. So staff can be aware and complainant can be aware of exactly how issues will be investigated or how issues will be handled. One of the key points then of the complaint handling procedure is just recognise the importance of learning and continuous improvement. So it is about the capture of the data, and we also recognise, I suppose, that the quantitative analysis and interpretation of the data is actually quite difficult, because if service A has more complaints than service B, it doesn't actually say, it doesn't necessarily say that service A is worse. It just might be more that there is, a different demographic of patients, or it could relate to openness or, transparency, that information is being recorded and captured. But one of the key aims is about learning and continuous improvement. Just look briefly then at the principles that support the complaint handling procedure. So we just start at the top and work around clockwise. So it is user focused. So as we've said, it is about putting the complainant at the center of the process. It's also about recognizing the needs of the individual complainant. So it is very much based on their perception of what happened. The second principle then is simple and timely. So as we've identified earlier, it's based on two internal stages. So you've got your stage one and your stage two. It also is about having reasonable timescales. So as we've said, stage one is 5 working days, and a stage two is 20 working days. The third principle then is about being thorough, proportionate, and consistent. So that is about making sure there is an appropriate level of response or investigation into the issue. So for example, you would expect an investigation about catering against a more complex complaint about multiple clinical issues. You would expect the depth and timescales of investigation to be different. So it is about what is reasonable and what is proportionate to do. The next principle then is about being objective, impartial, and fair. So that is about making sure our complaint handling and complaints responses are based on the facts. So is what we're saying backed up by what is recorded within the clinical records? Is it based on organizational guidelines? Is it based on a particular policy? So how we've handled a person's care, is that based on best practice, or eh, do we can we build a view of the complaint from the records and from staff recollection? So it is also about being independent, so kind of stepping back from it and going, okay, complainant is saying this happened, what actually did happen. So it's just about trying to get into the core of the issue. The next principle then is about seeking early resolution. So we're seeking to resolve complaints at the earliest opportunity. We're putting an increased focus on dealing with complaints at stage one, and that should always be the focus on it, unless they're significant. It's about ensuring that local staff are trained and feeling empowered to deal with complaints at stage one. And I suppose it's just about then not escalating to a stage two based on the lack of available staff to maybe deal with the complaint or to understand the complaint handling process. So it is just about that frontline staff feeling trained and confident in complaint handling. The next driver is uh, about delivery of improvement. So that is arguably probably the biggest principle. So it is looking at the trends and themes across the sites or services, and then it's looking for that opportunity to learn and improve. One of the biggest things that we should get out of a stage two is if we are upholding or part upholding the issues raised by the complainant, we should have support and actions identified of what are we going to do to change this, or what have we already done to change this. That's particularly important that is reflected in the stage two response. If the complaint escalates to the Ombudsman should give due consideration to the depth of investigation that NHS Lanarkshire has completed and what learning has actually been identified or implemented as a result of the complaint. Because if they feel that they can add nothing further, they are less likely to proceed to their investigation stage, so that they're less likely to take the complaint on. This is really just about recognizing a complaint is actually a gift. I think that is difficult because obviously being on the receiving end of a complaint is not easy, and I think the complaint handling procedure and the support that NHS Lanarkshire has in place recognises that. But it's just recognising that using that feedback is an important tool. So it takes us back then to one of the biggest drivers and principles is about delivery of improvement. So across NHS Lanarkshire, just to put some context into the number of complaints that we receive, so in 2020 to 21, we received 2,122 complaints. That is for the acute division for North and for South. In addition, the family health services, so that's GPs, opticians, pharmacists, I'm forgetting one, GPs, opticians, pharmacists, and what's one? Oh, dentists. Um, and dentists. They received 1,148. So in total, uh, across the board, we received 3,270 complaints in 2020 to 21. That was actually an 18% decline from the previous year, and that's broadly attributable to COVID-19. Roughly about 65% of those complaints were dealt with at stage one. As we've said earlier, we are trying to increase the percentage of complaints closed at stage one. So we're trying to develop and implement mechanisms to increase complaints being closed at stage one. This slide is just representing of how the complainant and how the organisation will start at different points. So if we say that person one is the complainant and person two is the organisation or the staff member involved in the complaint, so we're trying to actually get into this middle, so we've got a common understanding of what is the complaint, so we'll start off potentially at divergent positions, and then through the processes that support the complaint handling procedure, we're trying to drill down into, so the complaint, if it was received by letter, will provide a summary of the situation, so it'll tell you what's happened. But then through further discussion with the complainant, we'll actually be drilling down, to kind of go, okay, what would you like to resolve this? So what's going to make this better. And it is just about getting that understanding at the start of an investigation or when we're looking into a complaint. So this is particularly relevant at stage 2 complaints or more complex complaints. So if someone comes to us and says, I want to make a complaint about ABC, um, and I want the chief executive sacked, at least we have an understanding to kind of go, we are completely on we're completely divergent on that thought, and that is very unlikely to happen, as a result of your complaint. Whereas if someone come and said, I'm looking for improvements to be made to reduce the likelihood of this happen to another family, at least we know that our starting positions are more aligned. So it's just really, this chart is saying then that we might start off with positions, but through questioning and through communication and discussion, we're trying to get in deeper to look at the needs of the complainant and also the organization and staff. So it's just trying to bring resolution to a complaint. We're actually trying to get into this middle crossover triangle. Just briefly mention the perceived justice theory. So there's research about why complaints escalate. So why complaints take it through different stages, or you know why is there persistent complainers, for want of a better term. Um, so some of it's based on perceived justice. So if a complainant thinks there's procedural justice, so is the process fair? So the complaint handling procedure then, by having a standard process which is based on best practice, as long as we comply to that, then we can evidence procedural justice, to make sure that we are fully compliant and handling the complaint in line with best practice. The interactional justice then is so was the person treated fairly and well during the process? So that's why we're changing some of our processes to support early engagement with the complainant, understanding what they're looking for, agreeing the terms and scope of the investigation. So that's just about the interaction. So also, was our letters clear? Was the learning clear? Was how we investigated it clear? So, have we advised the complainant, you know, what we done to come to our conclusion within the complaint? So who did we get statements from? What processes did we look at? What policies did we look at? So it's just it's really about that communication interaction. Uh, the final one then is distributive justice. So that is about the outcome and redress. And again, as we said in an earlier slide, it's also important just to be clear from the outset of any complaint investigation what redress the complainant is seeking. So again, we can be as closely aligned as possible, so we know what the complainant is looking for. So in the early example, if someone says, I'm looking for staff member A to be sacked, at least we can have the early dialogue and conversation with them to kind of go, that is unlikely to happen, under the complaint handling procedure. This slide then is just recognizing then that for the complaint handling procedure to be effective, it's important that it supports staff, it's clear to the complainant, and then it's also clear and well managed within the organisation. So just on the staff side then, there was research in the University of Glasgow from 2017. 71% reported that their work practice was negatively affected by a complaint. 67.2% reported their health and well-being was affected, and 61.2% reported their attitude to service users being affected. This research was not specifically health, but it gives us an indication of the impact sometimes that complaints can have on staff members. So we've implemented processes to try and support staff through the process. So, for example, if you're uh, involved in a stage 2 uh, complaint investigation, you will be sent a booklet which will advise you of how to write a witness statement and what information we're looking for. And it will also signpost you to support within NHS Lanarkshire, whether that be through your line manager or your supervisor or uh, through staff wellbeing. Patient affairs staff can also guide you through the process. So that there is further information within the witness statement guide, and information is currently also being updated on First Port. Another important mechanism of staff support is NHS Lanarkshire operate an unacceptable behaviour procedure which supports the complaint procedure. So if a complainant is being persistent, or if they're failing to define their issues of complaint, or if they're trying to change their issues of complaint, there are procedures in place. So they are managed through patient affairs, and it's broadly based on the principle of giving the complainant a warning. It's giving them an opportunity to change their behaviour, and if they don't change their behaviour, then it's about taking sanctions. So those sanctions could include things like a single point of contact, or we will only communicate with you by email or by letter or by phone call at a particular time on a particular day. So it's just to make you aware that there is scope, and you should speak to your patient affairs team if a complainant is being particularly challenging. So if we were doing this in a classroom scenario, we would normally have a discussion about making a complaint. So that could be anything, discussing a situation where you've made a complaint against, your energy provider, or, a holiday company or a hotel. And then also we would discuss then if anyone had been the subject of a complaint, and, what they were looking for from that process. Broadly, the outcome of this exercise is, if we have two contrasting lists, what the complainant is looking for and what the person subject of the complaint is looking for are actually quite similar. And it takes us back, to making sure the procedure is clear, making sure it's fair, so it takes us back to some of the principles that you would expect to be in a complaint handling procedure, but it also um, takes you back to the perceived justice theory. So was the procedure fair? Was the interactions fair? Was there a focus on getting redress? How did we make it right? So this exercise in a classroom setting, it normally identifies that actually the two parties are looking for pretty identical things. So from the complainant's perspective, it's just important to consider emotions during the complaints process. So complainants could be particularly distressed. They may be acting out of character. So from a staff side, then it is important to be able to empathise with them, and I suppose the importance of communication style. So I suppose the complaint handling procedure is underpinned by effective communication, and the different people involved on understanding the different needs of all involved. As we said earlier, it is really about perception. So perception is the reality for complainants. So if they think A, B, C happened, the complainant, that is their world. So their experience is their truth. So the complaints handling procedure is about identifying and getting into the issues which the complainant has raised, and then responding to them appropriately. Final point then is it's okay to feel vulnerable. And I think that could be from either, so that could be from the complainant, or it also could be from the staff member. As we've said at stage one, frontline staff are empowered to deal with complaints. So it is about having that culture that feedback is critical, and there is that focus on early resolution. So the focus should very much be on getting to that end point of seeking and identifying what redress would make this better for the complainant. Saying sorry is also important. There are particular courses that we can offer in relation to effective apologies and effective communication with complainants. So under the complaint development plan, we were just trying to make improvements into some of our complaint processes. So at stage two, so when a complaint has investigated into investigation, we recognise it's important to understand the complaint. We want to understand and agree the scope of the investigation, and we also want to understand uh, their expectations and manage those expectations. So it's about keeping a sense of reality and communicating that clearly to the complainant. So patient affairs will broadly have an uh, early discussion with the complainant to kind of go from reviewing your correspondence or from our telephone conversation, we believe that you're complaining about A, B, and C. Is that correct? You need to identify at an early stage that if you disagree with that, and also recognizing then, as part of that conversation, they may say, I want, to reduce the likelihood of this recurring to another family, or, it's just about keeping those expectations real. We're also making changes then to our investigation approach, and we're changing our witness statements to put an increased focus on the learning. So if you receive a complaint, you will be sent that information from patient affairs. And then just the last thing that we are trying to fully embed is the learning, and I suppose that is at different levels. So if it it's for staff who've been involved in a complaint, it's for sites or specialties to also capture the learning. But then at organizational level, then it's just about looking for themes. So this year we're looking at a healthcare analysis tool, which is a national model, based on research, which helps categorize health complaints to get meaningful analysis of themes and areas for improvement. So any complaint investigation, now this arguably equally applies to stage one and stage two. What we're trying to do is find out what happened, what should have happened, and is there any learning identified? So it's just a step up process. So we're having the conversation with the complainant about what happened. Then we're getting the opportunity to consider it. So we're looking at the records. We're under stage two, we're getting statements and to see what should have happened, and then we're coming to conclusion about whether the complaint should be upheld, part upheld, or not upheld. So for upheld and part upheld, then it's looking to see if there's any identified learning, and then capturing that learning again at different levels. So we would capture it within the response back to the complainant, but also then capturing it within DATEX, which your patient affairs staff will input, and then just monitoring that across the organization just for recurring themes. So to form a complaint response, and most of this is covered in the witness investigation guide, which will be sent to you if you are being asked to comment on a complaint. So effective investigation should answer the 5 W's and how. It's also important then just to read the medical records, um, just to refresh and review your involvement in the case, And then it's also just important to identify if the records confirm your recollection or your account of events. It's just important to be accurate, precise, and factual, and just recognizing also then that the complainant will not be likely to understand complex medical terminology. So when responses are being drafted, it's just important then that they are understandable, and that medical terminology is clearly explained. One thing that we also try to do in complaint responses is use the terminology that the complainant has identified in their correspondence. So, if they've got a particular style or they make a particular reference to something, we would try and reflect or replicate that within the complaint response. So then it shows then that we've got a common understanding of, we've understood what the complainant is saying, we've taken that on board, and then we're responding to their particular issue. So the final stage is the Scottish Public Services Ombudsman. As we've said, just the Ombudsman, when they receive a complaint or when it's escalated directly by the complainant to them, they will consider issues around proportionality. They'll look at reasonableness. So even if they proceed with an investigation, they will make a determination, so was the current treatment reasonable? Was the communication reasonable? If they uphold or partly uphold the complaint, they will conclude their report with identified learning against the board. So they will say, NHS Lanarkshire, we are looking for evidence of implementation of A, B, and C by such and such a date. Or within our stage 2 response, if we have said, we've already taken learning aboard and have already started or commenced actions, they may come back and say, can you evidence, you told the complainant that you were doing this as a result of their complaint. Can you evidence what you have done to date? So the ombudsman themselves too are trying to put an increased focus on early resolution, even when complaints escalate to their organisation. So, they may come to us and say, as a first point, they may say, send me the complaint file or send me the medical records, or they may say, you said you were going to change this procedure. Can you demonstrate that you've changed this procedure? So they may request that information before they decide what they're doing. There is 2 options that the ombudsman can do. So they can produce a decision report, which will be after they have considered independent clinical or medical advice from their advisor. Once they've considered that, then they'll make a determination within that report. Or the other option they have is a public investigation report. So if they think the learning from the complaint is so significant, they will release it publicly, and there will be identified learning, and it will be widely shared across, across public forums. All decision reports and public investigation reports go in front of Parliament, so they're aware of the complaints coming from different organisations. In 2020 to 2021, NHS Lanarkshire had 18 complaints that proceeded to ombudsman level. As I said, then the most common outcome of an ombudsman complaint is a decision report. They will advise whether it's upheld, not upheld, or some of the issues may be upheld, so it's part upheld. The key messages then from this is, if you receive a complaint, always consider it at stage 1. Don't panic and don't become overly defensive. Seek support and advice. So whether that be direct line management or supervisors, but also patient affairs staff. So each acute hospital has a patient affairs team. There's also then a central corporate team in headquarters in Kirkland, and there's also a patient affairs team that covers primary care, so North and South Partnership. Also, another key message then is just being honest and reflective. So if you have received a complaint, it's just about taking that opportunity to step back and going, could I actually have done anything differently? Which takes us nicely on to the next key message. So it's about the key driver of the complaint handling procedure is seeking that opportunity to learn and improve. If we think back of the one of the early slides then of the process, it also is important to deal with complaints promptly and fairly. So there is a national process. So under stage 1, there is obviously the 5 working days, which can be extended to 10 working days. If we don't resolve something within 10 working days under stage 1, it must be escalated to stage 2. So that just emphasises the importance of quick and timely focus and resolution. Also then under stage 2, so whilst there is scope to extend to 20 working days, that should be in pretty exceptional circumstances. So thank you for your time. If you have any questions, please contact me either by email or on Microsoft Teams. Thank you for your time.